YouTube, welcome back to my channel, man. And it's your boy. I'm back in 2024. But in this video, I'm just strictly going to talk about should you do a residency as a pharmacist. And trust me when I say there are mixed feelings about this, but I'm here to tell you from years of experience in the world of pharmacy, just as a pharmacy just employee in the hospital setting. Like I said, for about 9 years, I can straight up tell you that a residency is really subjective. And my answer to this is you should not do a residency. But this is just a personal preference. This is very subjective. So all of what I'm about to say is my own thoughts and opinions and what I've seen over the years working in the hospital space. But there are other people who will suggest you do a residency for whatever reason. But just it's all up to you and it's subjective. But I'm here to tell you, do not do a residency and my reasoning why. So without further ado, let's hop straight into the video. So should you do a residency as a pharmacist? And for me, the short answer is no. Here's why. But I'm going to list the pros versus the cons of a residency. So let's start off with the pros, right? The pro of a residency is networking. I would say networking is definitely one of the major pros of a residency. But I will honestly say maybe job security, but it's not like a very high job security unless you truly specialize in a 2-year residency where you specialize in a particular area. Then I would say the job security increases, but then again, you're limiting yourself because you went to school and you specialize specifically for this specialty, and you're only going to want to settle for jobs in that specialty, which can be very limited. So it's like a give and take. If you truly want to do a residency, you truly want to specialize, do it. However, I recommend you don't do a residency because it's not needed. Here's why. So all of the cons with residency is, first and foremost, you are not guaranteed a job after you complete your residency. In the pharmacy space, okay, we're not talking about medical doctors, we're not talking about dentists, we're not talking about no other doctorate level counterpart. We're talking about pharmacists in the world of pharmacy. Our residency is not required. There is no financial benefit of doing a residency 1 or 2 years as a pharmacist. I guarantee you our pay is not going to be substantially lopsided versus a non-resident trained pharmacy. Like your pay is going to maybe increase 10, 15K salary a year. That's it. Like you're not going to substantially see a financial return on investment if you do a residency versus a medical doctor, right? A medical doctor residency make between 60, 70, and 80K a year. And then the moment they're done graduating and become attendings in their respective specialties, their pay significantly increases, bro. I'm talking about like 250, 300K, 350, sometimes 400K, depending on their specialty. So they get a massive bump in pay. Meanwhile, pharmacists, like we barely touching like 160. I'm talking about a pharmacist straight out of school. I'm not talking about experienced pharmacists who've been working X amount of jobs for X amount of years. Sure, you're going to be touching like 160, maybe 170. But I'm talking about straight out of pharmacy school, you get employed. Straight out of residency, you get employed. You're not touching nowhere near 160, 170, 180. We're not coming close to 200K. I have yet to meet a pharmacist who is employed for whatever company making 200K straight out of pharmacy school, straight out of residency. Like it's just not happening. So the financial return on investment is literally laughable and lackluster. Why would you ever want to go through that? So a financial benefit for a pharmacy resident is non-existent. It just doesn't exist. I think that's the biggest trade-off, in my opinion, why you should not do a residency. Like it doesn't yield you a significant amount of salary over a non-resident trained pharmacist. That's number one. Number two, I would say the only reason you should do a residency, and this group of people includes if you have never worked inside of a hospital if you have zero hospital pharmacy experience as a person, period. Like, this is the only time you should ever do a residency, because you're going to feel like you don't know shit about hospital. You don't know how to work a hospital system. You don't know the logistics of a hospital. You don't know how to be an employee in a hospital. You don't know how to consult, look at their ordering systems, familiarize yourself with their system, right? It could either be Meditech is a popular system, Epic is a popular system, Cerner is a popular system. So it really just trains you on how to be a employee in the hospital by yourself. And that is the only reason I would say do a residency. But even then, like, I don't even recommend it, because think of it this way. If you get hired at whatever company, they still have to legally train you for X amount of time on how that system works, on how this company operates. So you still have to get trained, let's just say for about 6 weeks, maybe 8 weeks, 6 to 8 weeks, you have to get trained on how to do things their way, how to familiarize yourself with the hospital's protocols, how to, counsel, the things that they do, the ordering system that they use. You still have to get trained, and you can learn by getting trained. You are learning real world experiences, and 3 months later, 6 months later, a year later, now you familiarize yourself with everything they do. Now you're trained on everything they do just by getting hired as a full-time pharmacist and getting trained. You are literally doing the same exact thing as a trained resident pharmacist would, with full salary benefits. Like, it literally doesn't make no sense to do a pharmacy residency, because you're doing the same exact thing in residency as you would as a full-time pharmacist. There is nothing that you will not see in a residency program versus a full-time pharmacist that you can't see anywhere else. Like, it's absolutely absurd, but people get told, not necessarily lies, but they don't get told the realism of it. They don't get told the reality of the situation. Like, if you ask anybody, any pharmacist who done a residency, I guarantee you they're going to say, it's going to be mixed. But most of them are going to say it's worthless. Most of them are going to say they only did a PGY1, postgraduate year 1 residency, and they never done a PGY2. Why? It's because it's useless, and they take advantage of you, and it's just a lot of paperwork and a lot of like bullshit that's useless. And as a resident, you're getting paid dirt cheap. Like, you're getting paid the bare fucking minimum to do a residency. Meanwhile, your student loans are still accruing interest. You're still not making payments. Like, no one talks about that, how much debt we actually get into going into pharmacy school compared to the amount of money that we get paid. It just doesn't make sense logistically, financially. It doesn't make sense. So in that respect, this is why I tell people don't do residency. You have to look at the picture in its entirety and its totality. But when you're in pharmacy school and when you're going to these pharmacy conferences and you're talking to other pharmacists, they're gonna be like, oh yeah, do a residency to be more competitive and so and so, so and so. But in reality, it's all about who you know, and it's all about word of mouth. Someone to vouch for you. It's all about your personal pharmacy experience, right? Have you ever worked in a pharmacy before? Yes. Have you ever did this pharmacy work? Have you ever been exposed to this ordering system? Have you ever been exposed to how we do things here? Yes, yes, yes. If you answer yes to all of these things and without a residency, I guarantee you look more attractive than a person who's done a residency but who has never stepped foot in the pharmacy, who has never had years of experience in the pharmacy, especially in the hospital. Like, I'm telling you guys, the reality of the situation is, in the pharmacy space, as a pharmacist, being a resident trained pharmacist does not yield you any significant benefit over a non-resident trained pharmacist. A 1-year resident, let me break it down like this. When you do a residency, your first year is a general residency, right? You're going to be bouncing between different specialties. So you're going to 1 month in infectious diseases, 1 month in critical care, 1 month in the ICU, 1 month in internal medicine, 1 month doing general hospital stuff, 1 month doing administration, 1 month doing leadership. It's literally how to be a pharmacist in a hospital. That's the whole entire PGY 1 year. Your PGY 2, your second year, if you choose to specialize, you choosing to specialize in a specific area, which takes 1 year to specialize. So after your first year, now you really want to specialize. Let's just say you want to specialize in HIV medicine. You want to specialize in emergency medicine. You want to specialize in oncology. You want to specialize in critical care. It takes 1 year to do that. And then you're done. Like I said, your financial benefit is not going to be significantly higher over a non-trained resident. I would say they're going to tell you, like, during a residency, you get mentorship, you get to develop critical thinking skills, you get to work independently. Like, you can do all that stuff simply by just getting hired onto the pharmacy. Like, you can't train no one to think critically. Like, that shit just have to come natural to a person. You can tell people and educate people along the way, but that also comes with just working a job, right? You're working a job and you see something you've never seen before. Your colleague who has been working there perhaps longer than you can tell you, like, oh yeah, this is what we do, this is what it is, like, and now you know this from experience. Like, you don't need, like, I know I'm sounding like a broken record, but I'm giving you guys the reality of the situation. Like, as a pharmacist, it all depends on the person, right? Everyone's IQ different. Everyone studies different. Everyone reads literature different. Everyone interprets literature different. Like, for me, like, I'm so fucking intelligent. Like, I read so much literature. I am up to date on everything. A lot of hospital protocols, because I've seen it so many times. And yes, mentorship is always good, but how good is your mentor if your mentor is not even smart? Your mentor doesn't need to keep up with the literature. Like, you don't need a residency to have a mentor. So I would say it's so many cons to a residency. And think about this: when you do a residency, you can't not get everything you want. So when you do a residency, you're applying to residency programs that have residency programs, right? And it might not be in a state, in a city that you want. So if you want to do a residency, you have to move. Like, you have to go away. Let's just say if you live in Texas, right? You want to stay in Texas, but so many students applying to this, like maybe 2 or 3 residency programs within the state of Texas, like, your odds of getting there is like slim. So you get matched all the way in Montana. You get matched all the way in South Dakota, in Boston, in Phoenix. Like, you have to go. That is a realization that people have to come to terms with. Like, doing a residency, you're not guaranteed to stay convenient to where you want to be. It's so many variables that people just don't think about. But I think the biggest reason why people want to do a residency in pharmacy is because they think that it's going to yield them a lot of money, which is not, over a non-resident trained pharmacist. I guarantee you, we're not touching 200K. People think that it's going to make them more competitive. I guarantee you it will not. It's all about your interview and who you know. It only looks good on paper. I will give you that, sure. It only looks good on paper doing a residency. But, bro, you know how many people have a residency? It's normal now. And it's mixed when it comes to hospitals. It's mixed. Some pharmacy trained people have residency. Some pharmacy trained people don't have residency. I know some brilliant pharmacists who never touched foot in the residency. And those pharmacists are significantly smarter than people who have done residencies. It's all about that individual on how smart they are, right? So these are my opinions. I guarantee you, if you ask a pharmacist, should I do a residency? If you show them this video, they're going to have mixed feelings, but for the most part, they're going to agree with everything I just said. Like, you can't really force no one, or as a pharmacist, you should already know a lot of stuff. You should already read up on literature. You should already know guidelines. You should already know how to speak. You should already know how to counsel. You should already know a lot of things that were taught during pharmacy school, during your rotations, like you should already know this. There's no reason for you not to be on top of a lot of different scenarios, right? I don't really think you need a residency to do anything, really. All you need to do is just get hired. They're going to train you, and while training you, while you're working the job, you're simply going to be proficient in it, and you're going to turn efficient in it over time. That's just the nature of the business. You're going to be proficient over time. The more and more you do it, the more and more proficient you be. The more and more you read, the more and more exposure you get just by working. You don't need a residency to do that. So it's really subjective. Like, you have to weigh in all the variables on residency. It does not yield us in the pharmacy space a significant amount of money over a non-resident trained pharmacist, right? Straight out of school, a pharmacist is making, with no residency training, depending on your job, depending on the location, we are probably making 125, 130-ish. That's average. Depending on where you live, they make less than that, like right around 100K, 110. Some places make more than that, depending on you work government job, for-profit, non-for-profit. They make probably 140, 150, but the average is like 130 straight out of pharmacy school, no experience, nothing. And I guarantee you, you're not going to make that much money over a non-resident trained pharmacist working a full-time job. We're not talking about part-time. We're not talking about per diem. A full-time with benefits salary, you're not going to be making substantially more than someone who is not residency trained. The only way you're making close to 200K as a pharmacist is either you're an entrepreneur, which you can make over 200K. You can make 300K, 400K. Entrepreneurship aside, in order to make that much money as a pharmacist, you have to have years of experience. You have to be in a leadership position, right? And that's the only way. A leadership position where you like a pharmacy director over hospital, over community, a district manager. Those are the only scenarios where you're almost touching 200K off a full salary. But other than that, any other aspect of pharmacy, you're not touching 200K. As a profession, as a doctorate level profession, we are doctors. It literally says PharmD, pharmacy doctors. Just like dentists. Dentists are doctors. Doctors of dental medicine. Doctors of dental surgery. Just like physicians, they are doctors. Medical doctors. Doctors of osteopathic medicine. So all of these people are other doctor counterparts, dentists and physicians and DOs. MDs and DOs, they get paid significantly more than us, and I see why, right? As a profession, pharmacy, our scope of practice does not allow us to intervene with patients physically, okay? We can't do procedures, we can't diagnose, and we can't do surgeries. So those three things is the reason why they significantly make more than us, right? We sort of have a offhand profession, right? We do everything offhand, like we don't touch people other than vaccines. That is the only time we touch people. But as pharmacists, as a profession, if it doesn't have to do with counseling and drug pharmacotherapy, drug treatment, that's it. But that is so important when we talking about healthcare, drugs. So we literally get paid for the knowledge that we know, not for our intervention skills physically, right? The most we can do is give a fucking, a vaccine, but we can't diagnose. We can't diagnose. We can't do procedures, and we can't do any type of interventions physically. Like, our scope of practice just don't allow us to do that because we're purely drug masters and drug dealers. So this is my spiel on should you do a residency or not, other pharmacies' opinion on the matter, and formulate your own opinion based off the facts, the realism, and I'm keeping it honest with you. I'm trying to connect with people on a deeper level than just surface level, what you see, everybody trying to be professional in your face, but don't want to give you the reality of the shit. Like, it does not yield you any benefit over a non-resident trained pharmacist, and that's just the reality of it. It all depends on you as a person, how smart you are. Like, you don't need to be babysit it and do a residency in one specific area where you can just get hired as a pharmacist. You're going to see the same exact thing. So if you have any questions about any other topic, I'm here to explain for those people who want to know what it's like in the world of pharmacy. So you know what to do. Shoot me a comment in the comment section. Have any more questions? I'm here. I'll support.